Hi, this is Justin in partnership with Rolling Out Health IQ, and I'm here with Dr. Donna Patterson. Dr. Patterson, thank you so much for being here with us today.
Thank you for having me, Justin. It's my pleasure.
Can you give our community a little bit on your background and what you do for a living?
Okay, perfect. Well, I have multiple jobs, I guess. I am a nurse practitioner. I have a doctoral degree. I currently work in the hospital setting with cardiology. So I'm a cardiology nurse practitioner. In addition to that, I own a medical spa in which we promote health and wellness in our clients. Specifically, we promote weight loss because it helps the foundation of the majority of the diseases that we see, type 2 diabetes, high cholesterol, heart attack, stroke, diabetes, are stemming from obesity. And so by promoting obesity, we're basically helping people reduce their risk factors for these diseases. That is what I do in the med spa setting in the hospital. I see all cardiac clients or patients that come in if they're having a heart attack, if they're having chest pain, congestive heart failure, anything that has to do with the heart, imbalance, atrial fibrillation, or irregular rhythm. I see those.
So what inspired you to become a nurse practitioner, and how did your background, influence, upbringing inspire this decision?
Well, initially, I worked in banking for 15 years. I've always wanted to be a nurse growing up. My grandfather was diagnosed with cancer when I was a young age, and I basically could not help him. He was in so much pain, and I would visit him in the hospital, and I felt hopeless, useless for the most part, because there's nothing I could do personally to help him. But I saw these nurses that were taking care of him, and I was inspired because I wanted to be able to make a difference in somebody's life. And I figured if I couldn't help my grandfather, then I can help others who may be going through the same thing.
And so when we think about that's it's an admirable story, an honorable switch too. I mean, from banking into healthcare. Um, what were some of the challenges to switch? I mean, that's the one heck of a jump.
It wasn't challenging at all. In 2009, the economy crashed. So I've always wanted to go to nursing school, but being an adult, having a family, it's just difficult quitting your job and going back to school. So I did my banking career, and every year I would apply to nursing school, but I never followed through on the application. It would just stop when they asked me for documents. But in 2008, 2009, when the economy crashed, I lost my job at the bank. And so I was forced to go to school, of course. And of course, it was my opportunity to pursue what I always wanted to do. And I enrolled in nursing school. So I had no choice at that time, I would say, because it was my only plan.
So how has being an African American woman then shaped your experience in the healthcare field? And in what ways do you feel like it could be an asset? Because there's so many things that could go against you. What are your thoughts on that?
It has actually shaped my perspective on how patients are treated. It has shaped my perspective on the disease that affect the African American community, like we mentioned before, the diabetes, the high blood pressure, the heart attack and stroke. And because it stemmed from obesity, of course, but also it stems from um, just lack of access. People are not being educated, especially you call them the underprivileged, maybe the underserved communities. They're not given the resources that they need. They may not be able to afford the insurance that are high cost. And so no one is teaching us as minorities how to prevent disease. In the hospital setting, I see that we're more reactive in the way we treat our patients. You come in and you're sick, we will take care of you, but we're not teaching you how to prevent these diseases. And I call it a band-aid. We put a band-aid on your problem and give you a prescription for a pill. And you keep coming back. My head hurts, you get a pill. My back hurts, you get a pill. I can't sleep, you get a pill. And so that has shaped the way I perceive healthcare as an African American, because I too use the system. And when I was in nursing school, I had to decrease my time that I was working from full time to PRN, and I lost my insurance at that time. And I could not access the system because one, I could not afford the insurance on the marketplace. And two, I was working in a hospital, but I had no insurance. And I had a patient said to me one day, "You're so lucky. You guys work here. You must have great insurance." Not realizing I am one of those people. I'm providing care, but I myself did not have insurance. And I could not afford health care, even though I work in the system.
So then to that point, were there any milestones, any moments in your career, your second career, that you think was a turning point, was a validation for you? And what did you learn from that milestone?
Actually being able to help. And that was one reason why I started Rejuvenir Health Med Spa, because during COVID, of course, the milestone for me was seeing that people who were African American, people who had high blood pressure, diabetes, a high cholesterol, were considered high risk for dying from COVID. And that was more like the haha moment for me. And so my milestone coming from that was to do something about it in terms of I want to make a difference in the life of people so that we as a community, we as a people are not always at the lower tandem pole, so to speak, when it comes on to receiving care and living healthy lifestyle. And so my milestone was starting a business that catered to helping people learn how to take better care of themselves.
What are some of the turning points with your business? I mean, that's also, I mean, business to healthcare back to business. Like, what are some of the moments in your business where you were like, ah, finally, right? Like, this is the business is making sense because there are a lot of times where sometimes the business could achieve its goals in helping the community, but profits may be a little bit harder to turn around.
Oh, absolutely. And we've only been in business for a year and a half. So it has been challenging, especially during the first year. But the haha moment comes for me in business through my client as I'm seeing them progressing and making changes to their lives. And they're telling me, I could not cross my legs sitting down before, and now look at me. Or I used to have all this pain in my knees. I couldn't walk or exercise, and I don't have pain anymore. Currently, I have clients that are down 60 plus pounds, 50 plus pounds in their weight loss journey. And so, even a teenager who's 17 years old, she told me, she said, I won't be the fat friend anymore because she has lost 57 pounds. And so her confidence has soared. And I realized that I'm making a difference in people's lives. And I think that was my ultimate purpose. Yes, I want to make money because the more money I make in business, the more people I feel I can help. And so the money will come, but I feel that the people that my clients that I've been serving have been assigned to me, and we just people come in there and they cry. You know, I have people are going through so much, mentally, emotionally, and you just don't know just by looking at a person. But when you sit down and start talking to someone and they just start opening up and crying, it really makes a difference in what I do, and that's my purpose and my goal.
So, what advice would you give to someone who is preparing for board certification? And what resources did you think were helpful? Did you have any mentors along the way? What were some like, it is a daunting task to do what you've done. Not only to switch, but then to get that board certification. That's a lot. Like, there
Yes.
are others out there who want to do that, just don't know, like, they love to understand how you did it.
Well, board certification for me, initially, going up to take my exam, I felt like I did not know what I was doing. So I enrolled in a review course. LEIK was the name of the person, Leak Review, LEIK. It was a 5-day course. So every day at 8 a.m. you logged on until about 2:30. And they'll just review questions and go through that. But in studying for the exam, I had to take time every day I took 6 weeks, and I committed myself for 6 weeks that I would study for 8 hours per day. And when that 8 hour time frame was, I would do nothing else. And when that 8 hour time frame was up, I would have dinner and spend time with the family. And before bed, I would go back and read again. Another point that I would like to make is that every um, every minute counts. So if you have a 15-minute time block that you're in between classes or you have some downtime, utilize that time to read something. You could go over one question. You could go do Quizlet and do a 15-minute quick review on Quizlet. It makes a difference because those times add up. And it's amazing how much you can get accomplished versus someone who just sit around and surf their phone and surf social media. You are literally learning and preparing yourself. And that is what made a difference in my preparation.
So from banking to being board certified back into now a hybrid of being a board certified nurse practitioner, but also now owning your own business. Question, right? Is it worth it? When you first thought about this and you said, I have a vision, because you got to have vision to do something like that.
Yes.
And then you do it, then the question becomes, because this is what the viewers want to see, like, is it worth it? Like, is this passion on your heart worth the risk, worth the trials and tribulation, monetarily, emotionally, spiritually, physically? Is it worth it?
Oh, absolutely. I would do it again if I have to. Coming from banking, banking in itself was fulfilling, but it not to this extent that I am fulfilled with patients and with clients. Because yes, you can help someone with their finances and do their withdrawals and plan, but when you're actually changing someone's life and their outcome and the quality of life that they're able to have, that is more fulfilling than anything else. And I've always said that when I lost my job in banking, initially I thought it was the worst thing that had happened to me. But looking back, I said it was the best thing that had happened to me because it allowed me to step into this career that I believe I was born to do. And so with the financial commitment, I have a lot of student loans. Like my student loan is a house payment. But would I do it again? Absolutely, because it has allowed me to live the life that I have. I did my associate's degree. I started with my associate's degree. Then I went back and got my bachelor's and I got my master's and I went back and got my doctoral degree. And so I just kept going because I wanted to practice at the highest level. And it is, like I said, even though I owe that much money in student loan, it has afforded me the life that I now live, not only in terms of taking care of people and helping people, but the life that I live outside of that because of my income, how much I make. Yes, we can always say they don't pay us enough. We can always make more money, but healthcare is always going to be around. People are always going to be sick and people will always need help. And so when it comes on to, if you were to compare it to banking, the economy crashed, you don't have a job. You're always going to have a job when it comes on to healthcare. So definitely, I recommended it to many people who have gone back to school. Many people have asked me, hey, do you think I should go back to school? And my answer is always absolutely yes. So yes.
Thank you so much, Dr. Donna Patterson. I really appreciate your time. And definitely be in touch with more information from you. And just, yeah, thank you for everything.
Thank you so much for having me, Justin. It's been a pleasure. And you have yourself a great evening.